It's my life. Lazy. It's my life. I got dirty. It's my life. I want shopping. It's my life. I need money. Yeah. It's my life. It's my life. I got dirty. It's my life. I want shopping. It's my life. I need money. Yeah. It's my life.
Hi guys, welcome back to my channel. My name is Monique Macri. If you're new here, karibu sana. So today we are going to talk about swelling of the feet during pregnancy. We call that edema of the lower limbs. Now this is a very common occurrence during pregnancies. However, as much as it's common and sort of normal, it usually puts a woman at risk, and we are going to address the causes of the lower limbs edema, which is the swelling of the legs, so the causes as well as the risks associated and how to be able to manage and prevent the edema. Okay, so I will start by showing you my legs. So at the moment they are very swollen. I'm not sure if you can be able to see. In addition to the swelling, there's a lot of pain here. So in this case, the swelling was because I stood for too long. I was also sitting for too long. So usually when you stand for too long or you sit for too long, there's a tendency for your legs to swell. However, the main cause, in the absence of high blood pressure, the main cause for the edema is because of the weight of the pregnancy pressing on the joints and the veins. That affects the effectiveness in which the fluids in your body are circulating, causing retention of fluids in the lower limbs. It is that retained fluid that leads to the swelling of the lower limbs. Now, you might be wondering, okay, fine, see, this is a common occurrence in pregnancy. Why are we addressing it? We are addressing it because, number one, it can be very uncomfortable because of the swelling itself. It's very uncomfortable. You feel like you're carrying an elephant. Also, it's also painful to some extent. And the third and most important point to note is that the swelling of the legs can increase your chances of a DVT clot. And you know what happens when you have DVT clots? Your life can, anytime. So I felt like this is a major concern that we need to address in a video. So now we've already known what causes the edema. Some of the causes, that is, the main one is high blood pressure, and also the weight of the pregnancy on the veins and the joints, which reduces the effectiveness of the flow of fluids in the body. So now, how are we able to prevent the edema of the lower limbs? Number one, I know a lot of people, you're busy, you're working, and nowadays we get to sit for too long. So maybe you're working in an office and you're asking yourself, how can I be able to manage edema? I'ma prevent it. Number one, let's say I've been sitting for 1 hour. So one thing you can do is that after some time, you can just put your legs like this, swing them. The fact that you're swinging them, you're increasing the flow of blood, okay? They are promoting efficient circulation of the fluids in your body. You can also do this, but this can be a little bit uncomfortable. From that, you can try to twist your ankle joint, twist the other ankle joint. Actually, this is so relieving, guys. You should try this. So those are simple things that you can do while you're still seated. So maybe you're working in an office and you don't have a lot of space for you to be able to move, or the nature of your work does not allow for you to move a bit, okay? But if you have the flexibility, like you're able to move from time to time, then all you need to do is, like, after every 2 hours, you can just stand up like this, move around for a bit, So the fact that you're moving increases the flow of blood and fluids in your body. Simply, it improves the efficiency of circulation in your body, and that is what we want to target. Then you can do a little bit of stretches to relieve the pressure of the baby bump on your joints and your veins. So you can do a little bit of stretches. These stretches come in handy, by the way. Then remember, this is where we are targeting mostly. You can also do a little bit of these circles and these circles. You see, these are very simple to exercises that you can do regardless of the space or the environment that you're in. So number one, there are those ones that you can do when you're seated. Number two, you can make sure that you're walking around for a little bit. Number three, you can be able to do the stretches. Number four, avoid sitting for more than 1 hour without doing something with your legs or doing the stretches. Number two, avoid standing also for too long. Standing for a maximum of 30 minutes to an hour, and then you make sure that you're moving around. If you don't have space to move around, if you're standing, you can actually do a little bit of, you can move a little bit on the spot. You can do these. You can do these. Although lateral movements are not recommended, mostly because of balance. Remember, balance becomes an issue during pregnancy. Yeah, so it's that simple. It was a very simple video, but also very important, because the number of women who suffer from edema and also the number of women who get complications as a result of edema is significantly high. So I hope you that is going to watch this video is going to take this information with the seriousness that it deserves. If you have any question, please ask in the comment section and I'll be ready to answer you. Until next time. Wait, I almost forgot. Another thing, you have to make sure that the shoes that you're wearing are comfortable and are not too tight. Okay, so that you ensure that you're not also inhibiting the circulation, which is already poor. So make sure that the shoes you're wearing allow for circulation. Maybe you can put on sandals, you can put on Crocs. Closed shoes are not the best by them, but mine, as you can see, is loose fitting. Yeah. So if you go wearing shoes that are very tight, and sometimes, like right now, I usually don't wear socks because I feel like socks, I don't know, but on the days that I wear socks, the swelling is a little bit more. Another thing, if your legs are like chronically swollen, or they get swollen for too long, then when you're seated, you need to be able to elevate your legs. Just hold on a minute. When you're seated, if you're able to find somewhere that you can use to raise your legs like that, will be very ideal, because it promotes better flow of blood and other fluids in your body. So you can either put them to be leveled, but if your legs are very swollen, you can try to make sure that, there's that elevation, there's that angle of elevation. That is another way of preventing the swelling. Now, remember, if the swelling is chronic and it's not going away simply by doing the simple activities, even when you're sleeping in bed, you need to make sure that you put maybe some pillows, or you incline your bed in a way that your lower limbs are slightly elevated compared to the other part of your body. So I think I'm going to make a summary. Number one, do not sit or stand for too long. Number two, ensure that you don't wear shoes that are tight. Avoid also wearing socks that hug you too much. Number three, when you have to stand, when your job requires you to stand, make sure that you keep doing a little bit of activities on the spot that will help with the better flow of blood. If you're seated, there are also some exercises that you can do that also ensures that you're promoting better circulation. We also talked about elevating your legs when you're seated, even when you're sleeping. I think that's about it.